I've been in practice in this area for 25 years performing thoracic surgery, and we've taken great pride in some of the technological advances that have occurred over this 25-year process. And we've found more and more as the program grows that we see more and more patients driving to our area to get their thoracic surgical care. One of the things that sets us apart at Watauga Surgical Group is our ability to provide efficient, individualized care for our patients. We are fortunate to have some amazing extended care providers, whether those are nurse practitioners or physician assistants. They provide wonderful, individualized, compassionate care alongside the physicians that work in our organization. So typically, the patients and their families know the extended care providers very well, and they also know their surgeon very well. And we don't want to just know the patient from a surgical perspective. We like to know them and their families. We like to know what other needs they might have, whether it be related to work, whether it be related to other stresses in their lives. One of our goals has always been to provide minimally invasive surgery so that we can get people back to activities of daily life and back to work as soon as possible. We also are open to spiritual requests for patients. Oftentimes, I have the privilege of being able to pray with patients before surgery if that's something that they value. And the other thing that a lot of our patients like about being referred to us is it can be very intimidating to go to one of the larger university hospitals and have to navigate through 3 or 4 or 5 parking decks and multiple entryways and multiple hallways. But here at our facility, patients are easily able to access the facility. There's a single entrance. We take pride in our brand new hospital building, our brand new operating suites, our brand new minimally invasive Vinci 5 robot, and patients are very delighted to receive those resources and that technology here, but also they're very grateful for how simple it is to navigate into our facility. So, for example, if you're a patient and you've been diagnosed with a lung mass, um, if you or your provider contacts our office, we are usually able to rapidly set up an appointment to see you, to review your x-rays, and to come up with a plan for how we're going to address this mass, whether it just requires conservative follow-up with repeated x-rays in several months, or whether you're going to need a minimally invasive procedure that we can usually schedule very quickly. Also, if you are a provider and you're not sure what the next steps might be, we do both interventional pulmonology type procedures for diagnosis. We also provide the entire breadth of thoracic surgical care, and we do this with the most advanced technologies, including minimally invasive video assisted thoracic surgery as well as robotic surgery.